I'm Dr. Byron Jones. I'm a board-certified physical medicine and rehabilitation specialist. We're also called physiatrists. I've been in private practice in the Denver area since completing training in 1990, and my practice consists of outpatient treatment of musculoskeletal disorders, spinal disorders, and neurologic conditions. Do a lot of pain management, but I do not consider myself a pain doctor per se. I consider myself a rehabilitation doctor who has to treat pain as part of what he does as a rehab doc. Yeah, well, I was very, very impressed with the clinical philosophy of the company, headed up by a physician who's phenomenally knowledgeable, was also very innovative. And I happened to meet Dr. Stewart, and we had a conversation about pain and decreasing patients' dependence on opioids and the opioid doses. And there's such a huge need for this out there, and that's where meeting of the minds kind of occurred. I think there has been a marked change in terms of pain management, certainly since I started in this field 30 years ago. It used to be that we considered it very appropriate to use high-dose medication management, utilize medications, including opioids, aggressively. Over time, we realized that we probably overshot and we created problems for patients and certainly for the doctors. There were changes in terms of approach and recommendations and even in the governance of these types of medications. In doing so, we kind of forgot about the patient. So we decreased doses to a level that made the patients who were formerly functional non-functional. That's been the biggest challenge, and it was one of the largest reasons that I chose to look at what other alternative approaches can we use that will bring back the focus on the patient, improve quality of life, and get their pain under adequate management. The basis for me wanting to look at innovative things dates back to some of the positions that I've had in medicine. Biggest one being I spent 10 years as a medical director and then chief medical officer at a managed care organization. Fantastic experience, taught me a lot about the way medicine works from both sides. We had about 2 million covered patient lives, 7,000 providers, and part of my role was to review types of treatment that were out there. So I had several that were really fun. One was the use of computerized traction machines for spinal pain. Had fantastic results, was kind of going against the grain with that. I then developed 3 different spine programs that were multidisciplinary programs. Those were all very successful and prevented the need for unnecessary surgeries, unnecessary diagnostic testing. And then the latest has led me to what I think we're talking about today is the use of alternative adjunctive treatment in chronic pain. Yes, I had really no expectations. I had hope that they were going to be effective. By effective, I mean in terms of decreasing the total dose of opioids that were necessary to keep pain manageable, but even more so to help improve patients' level of physical function and quality of life. I found surprising results in my observational study. We had 16 patients who were in this study, had a 50% response rate in terms of being able to decrease their total dose of daily opioids. I was very impressed by that. The average reduction was 36% in those patients that responded. 94% of the patients continued on the OER formulation even after the study was completed, and that was because of the benefits that they received from it. I saw no retardation in terms of the effectiveness of the medication. I saw no patients that escalated in terms of their dose of opioids during the time. And once we found a steady state for the titration of OER, patients were able to maintain on that. There's one patient that I think that was in the OER observational study stands out in my mind, and this was a woman who had very severe multifactorial pain. She had had bleeding into her brain and a stroke, was hemiplegic, had chronic spinal pain, markedly dysfunctional, was placed on OER, and she went from being on significant doses of both sustained and short-acting opiates to being able to get completely off of them while maintaining and actually improving her level of function in the study. That was so tremendously satisfying because she had had such a multitude of treatments in the past. I believe that Entourage products may be helpful for many of the people that I interface with. In chronic pain management, any of the MDs, DOs who do this, I believe the OER formulation should be strongly considered. If there is sleep dysfunction involved, consideration should be given to the ZZZ formulation. And if there are other musculoskeletal issues, be it tendonitis, arthritis, things of that nature, the liposomal cream and Verisome cream, I think could be tremendously beneficial. For the other non-physician specialists, be acupuncturists, athletic trainers, massage therapists, physical therapists, even chiropractors, I think there's tremendous potential for consideration of both the ZZZ if there's a significant sleep dysfunction and the creams for pain management of the other musculoskeletal disorders. I believe that there should be strong consideration with a procedure called radiofrequency ablation, or RFA. This is where we go in and we burn the nerves that go to the joints in the neck and back. And one of the side effects of that procedure can be fairly severe nerve pain, and patients describe it as a severe sunburn sensation. And I believe the use of the creams may be beneficial in terms of decreasing the discomfort. Would likely want to do it both before and after, so sort of prime the system. And again, I think this would make the procedure even more tolerable without any bad effect on efficacy. In setting up the observational study and talking with patients, they are very interested in alternative treatments. They are tired of the scrutiny that they're under and being kind of held hostage to their pain medications. You have to realize that there are adverse effects and negative consequences of patients being on opioids. There are tolerance issues. It can cause constipation. They can decrease immune function. They can cause euphoria. They can cause problems with motor skills. And so I think having something like this that in my observational study was found to be effective and safe in a number of the patients as an alternative is a tremendous benefit. I was pleasantly surprised how enthusiastic the patients were in terms of going down this road and seeing if this worked. In the observational study, we only had 2 patients that had adverse events. They were both euphoria. One was very minor and did not change the patient's treatment at all. The other had euphoria that was significant enough that they voluntarily decided to discontinue OER, but it was the only patient that did so. Learn about the endocannabinoid system. It is a part of every human's anatomy that has been present since the onset of man. It is a system that we are woefully ignorant about in traditional medicine. I knew this much about it when I started. It has effects on pain, inflammation, mood. Really encourage people to learn about it and feel comfortable and safe in terms of utilizing these types of products. I think my last point would be that Entourage is a company that makes medical products for medical conditions. They're the best in the industry that I have seen.